Stimulant addiction affects men in ways that often go unnoticed until the damage is well underway. Because stimulants are commonly associated with focus, productivity, and performance, many men underestimate how quickly dependence can develop. This video is here to explain what makes stimulant addiction different, what to expect if stimulant use has become a problem, and what real recovery requires for men. My name's Chris Burwash. I'm the founder and CEO of Into Action, and I'm also a man in long-term recovery. I've lived addiction firsthand, and I built Into Action to address stimulant addiction honestly, with structure, accountability, and a long-term approach designed specifically for men. Stimulants include such substances as cocaine, methamphetamine, and prescription stimulants like Adderall or other amphetamines. These drugs stimulate the central nervous system, increasing energy, focus, alertness, and confidence. Over time, the brain becomes dependent on that stimulation to function normally. Stimulant addiction in men often starts with performance. Men use stimulants to work longer hours, push through pressure, stay sharp, and feel more confident socially. As tolerance builds, higher doses are needed to achieve the same effect. Eventually, stimulants stop enhancing performance and start controlling behavior. Warning signs of stimulant addiction often include drastic changes in sleep, increased irritability, impulsive decision-making, secrecy, and emotional volatility. Many men become impatient, aggressive, or withdrawn. Risk-taking behaviors often increase, while judgment and emotional regulation decline. Physical symptoms of stimulant addiction can include weight loss, exhaustion, headaches, heart strain, and disrupted sleep cycles. Emotionally and psychologically, men may experience anxiety, paranoia, depression, mood swings, or difficulty feeling pleasure when not using. Over time, motivation and confidence are replaced by instability and burnout. Stimulant withdrawal is primarily psychological, but can be extremely challenging. When stimulant use stops, many men experience severe fatigue, depression, anxiety, irritability, difficulty concentrating, and intense cravings. The emotional crash can feel overwhelming, especially for men who relied on stimulants to function or perform. Because stimulant withdrawal involves such a significant loss of energy and motivation, many men relapse quickly when trying to quit on their own. The brain struggles to regulate mood and focus without stimulation, making daily responsibilities feel unmanageable without structure and support. Long-term stimulant use carries serious risks. Stimulant addiction strains the heart, brain, and nervous system. It increases the risk of anxiety disorders, depression, paranoia, and impulsive behavior that can damage careers, relationships, and self-respect. Over time, many men feel disconnected from themselves and burned out from constantly pushing beyond their limits. Stimulant addiction requires a structured, disciplined approach to recovery. At Into Action, we work with men who are ready to stop living in overdrive and start rebuilding balance. Structure, accountability, and consistency are essential because stimulant addiction thrives on chaos, intensity, and avoidance. Into Action Recovery in Phoenix, Arizona provides stimulant addiction treatment designed specifically for men. Our approach combines evidence-based clinical care, 12-step integration, physical restoration, and a men-only recovery environment. Clinically, we address stimulant-driven patterns through therapies such as cognitive behavioral therapy, trauma-informed care, motivational interviewing, and relapse prevention. The 12-step component of our stimulant addiction treatment is non-religious and focused on honesty, responsibility, and internal change. Men learn how to manage cravings, regulate emotions, and rebuild purpose without relying on constant stimulation. Physical recovery and routine are critical in stimulant addiction treatment. Long-term stimulant use disrupts sleep, nutrition, and nervous system balance. Through structured schedules, physical conditioning, nutrition, and consistent daily habits, men begin restoring energy, discipline, and confidence. Recovery here is active and intentional. Brotherhood plays a major role in stimulant addiction treatment at Into Action. Men recover alongside other men who understand the pressure, burnout, and crash cycles tied to stimulant use. This is not a passive support system. It is a community built on accountability, honesty, and shared responsibility. Recovery from stimulant addiction is not about learning how to perform without drugs. It is about building a life that no longer requires constant intensity to feel worthwhile. At Into Action, we focus from the beginning on long-term recovery. Transition planning, continued accountability, and ongoing connection help men maintain progress after treatment. Stimulant addiction does not have to define the rest of your life. With the right structure, support, and commitment, men can recover and stay recovered. If you recognize yourself or someone you love in this description, Into Action is here to help. Our stimulant addiction treatment program in Phoenix, Arizona is built for men who are ready to take responsibility and change. So get into action today and give us a call.